Welcome back. Joining us is Dr. Bruce Ward of the BC Dental Association. Hi there, Bruce.
Hi.
Now, Grant Ayrton, he's a guy who's saying, yes, I'm going to be absolutely healthy in every aspect of my life. That's got to extend to the teeth and mouth too. What can he do to ensure maximum health in that area of his body?
Well, first of all, he needs to keep getting his teeth checked out by a dentist on an annual basis at least, just to make sure there's no problems occurring. But lots of stuff happens to us as we get older, to our dental health, to our oral health. Lots of changes in the mouth with age. It includes the color of your teeth. The teeth start to change color a little bit. They get darker. The gums recede. They expose more of our roots. It's kind of like the perfect storm for dental decay, actually, because as the gums recede, they expose our roots. As our roots are exposed, roots don't have the same capacity to ward off decay as enamel does. So there's more of the tooth exposed to the mouth, and so more possibility for decay and breakdown.
Bruce, this isn't sounding good so far. I'm
No.
getting scared.
The third thing is as we age, our saliva flow actually slows down as well. So now you've got a drier mouth with your roots exposed, and decay happens and breakdown happens. So you really need to stay on top of it. Root caries is a huge problem as we get older.
And this whole thing of receding gums, that seems to be something that...
Oh, it happens. It happens actually two ways. It happens normally as we age. Our gums recede because our tissues, just like everywhere else in our body, our tissues lose some of their elasticity. And so they tend to sag and droop. But in this case, they're actually sagging and drooping on our teeth.
It's so unfair.
I know, it is. There's no justice,
Okay.
even in our mouth. So that's one way it happens. But in another, as we get older, sometimes our ability to keep our teeth clean, our manual dexterity changes. And so our teeth tend to develop a little more buildup. A little more plaque accumulates along our gum line, and that actually contributes to recession too. The third thing is, we've been told to brush our teeth all our life. And sometimes people think more is better. So I remember when my mom, when she was a kid, she was told to brush her teeth till they bled. She would brush and brush and brush and brush, and she did for her whole life. So brushing your teeth really vigorously with a hard brush actually also really speeds up gum recession.
And then, I hate to even introduce this, another issue. We're taking more medication, right?
We're taking more medication.
That's got to do something.
Absolutely. So many medications have effects in our mouth. Some medications make our gums swell. Some medications make our mouth dry. And as our mouth gets dry, as I said earlier, saliva really helps to keep the caries rate, the cavity rate down in our mouth. So also some medications give us mouth ulcers, and we don't want to do anything in our mouth because our mouths hurt too much. And that's a big consideration when it comes to eating a good healthy diet. So if your teeth are sensitive, if you've got mouth ulcers from the medications, then we stop eating or we stop eating well, and it affects our overall health as well.
Okay, buckle down, make the effort, floss like crazy.
Absolutely.
Yeah, okay.
Absolutely. And see a dentist on a regular basis. What happens with a lot of people is when they stop working, they figure, I've had all my dental work done, I'm fine. And then what happens is, as all of these factors begin to contribute to the breakdown of the dental work they've already had and their teeth, which haven't had any dental work, they need help more than ever. So staying on top of your oral health on an ongoing basis is probably the best thing you can do for yourself as we head north of 49.
Dr. Bruce Ward, thank you so
Thanks.
much.
North of 49, a guide to the rest of your life.